Hello friends, it's 25 MCQs we are back with it, and okay, the questions which I will be discussing is first is a Biochem question. So the question is, which of the following lipooxygenases is involved in the synthesis of leukotrienes? So options are 7 lipoxygenases, 12, 15 or it's a 5. So I will just repeat the question. The question which I am discussing is a Biochem question, and the question is, it's which of the following lipooxygenase is involved in the synthesis of leukotrienes, and the options here are 7 lipoxygenase, 12, 15 or 5. So which of the following lipoxygenase is involved in the synthesis of leukotrienes? So you know what is leukotrienes, and really leukotrienes are basically it's in asthma also you have seen. So basically they are potent vasoconstrictors. So I think it's that only. So they are the potent potent constrictors of the bronchial airway, and which will cause constriction, and we have seen that in asthma also. So the question was, which of the following lipogenesis is involved in the synthesis of leukotrienes, and the options was 7 lipogenesis, 12, 15 or it's 5. So if you know the answer, you can just tell it's 7, 12, 5 or 15 lipogenesis which is involved in the synthesis of leukotrienes. So okay, the answer here is D, that is the 5 lipoxygenases is the right answer. And as you know what I told, it's a leukotrienes. Leukotrienes are basically they are the potent constrictors of the bronchial airway, seen in many inflammatory conditions as well as in the hypersensitivity reaction like in asthma also they have been seen. Let's move on. It's a PSM question. The question here is very simple. If an event, that is A, and one more event is B, are mutually exclusive events, so what is the probability of either A or B occurring? And the options are, that is A plus B, option B is A into B, or it's A plus B minus P in brackets A plus B, and it's 1 minus P A plus B. So it's an easy question. If you know, in the afternoon only we have discussed this question. The same question was there in the afternoon also, and the question was, what the question is, if the event A and B are mutually exclusive events, so what is the probability of either A and B? It's P, that is A plus B, A into B, or it's A plus B minus A and B, or it's 1 minus A plus B. So it's a PSM question. If you know, it's good only. But in the afternoon we have discussed this. It's like that only. Its answer is A. So if there are two exclusive events, so the answer will be A plus B. That is the A is the right answer. A plus B. And suppose if there is a two exclusive event, that two at the same time, if it is at the same time, the formula will be P is equal to A into B. And if it is like it's a non-exclusive events, so if it's a non-exclusive event, the formula changes to, that is A plus B minus P into A and B. And if there are only two possible events, that is if there are only two possible outcomes, it will be like A plus B equals to 1. So I have to remember the formula. It's a PSM question, and the answer was A plus B here, as it's a mutually exclusive event. Next we move on. It's a easy one, I think. Functional residual capacity is, you might be knowing this answer. I'll just repeat. It's a functional residual capacity is, options are volume aspired after normal inspiration, or it's a volume that remains after forced expiration, or it's a aspirated reserve volume plus residual volume, or it's a tidal volume plus inspirated reserve volume. So basically they are asking the formula here. So what is the functional residual volume capacity? So what is the functional residual capacity? And it's a formula. So I'll just repeat the options here. It's a volume aspired after normal inspiration. It's a C only. C is the right answer. And it's like volume that remains after forced expiration. It's aspirated reserve volume plus residual volume, or it's a tidal volume plus inspirated reserve volume. So the answer is right. That is C is the right answer. So functional residual capacity is aspirated reserve volume plus the residual volume. So you have to remember the lung capacities. It's all the vital capacity and all that tidal lung volume. So moving on to the next question. The question we have, which is the drug of choice for controlling BP in a patient with severe preeclampsia? Is labetalol, hydrazine, that is hydralazine, nifedipine, or is methyldopa? I know the answer. So I'll just repeat. It's which is the drug of choice for controlling BP in a patient with severe preeclampsia is labetalol, hydralazine, nifedipine, or methyl-dopa? I know you know the answer, but if anyone wants to answer this, drug of choice for hypertension and preeclampsia. Yeah, it's A. Labetalol is the right answer, and we can give in both at pregnancy only. So yeah, it's a drug of choice for severe preeclampsia, and it is avoided in patients with asthma and congestive heart failure due to bronchoconstriction. So yeah, we will move on to the next question. And next we have it's a forensic question, that is punishment for murder by an ordinary person and punishment for murder by a life convict are respectively defined as under. So they have given the section, that is section 301, section 302. Yeah, it's a labetalol was the right answer. So yeah, what we are discussing here is it's a punishment for murder by an ordinary person and punishment for murder by a life convict are respectively defined under what? Like section 301, 302, 302, 304, 302, 303, and it's a 303, 304. So if you can just guess also, it will be good for you. So yeah, punishment for murder by an ordinary person defined under which section, and it's by a life convict defined under which section. So yeah. Okay, the answer is it's C, that is 302, that is 302 and 303. So basically, if the punishment is like for a murder by an ordinary person, it's under section 302, and if it is by a life convict, it's under section 303. So yeah, it's not 304. It's 304 is basically 304 is punishment for a culpable homicide not amounting to murder. So it's not 304, it's basically 302, and 303 is the right answer here. So I'll just repeat. It's 304 which we're telling it's a punishment for culpable homicide not amounting to murder. And 304B also there. 304B, it's a dowry death. Next we have which of the following would be an indication for surgery in a 30-year-old woman diagnosed with PID? Options are a tubo-ovarian abscess of 2 cm, peritonitis, sepsis, or it's an interstitial obstruction. I repeat, which of the following would be an indication for surgery in a 30-year-old woman diagnosed with PID? Options are tubo-ovarian abscess of 2 cm, peritonitis, sepsis, or it's an interstitial obstruction. So yeah, if you know the answer, you can just tell. Indication for surgery in a 30-year-old woman diagnosed with PID. Anyone wants to answer this? Okay, I will tell the answer here is basically it's D, that is the intestinal obstruction. So yeah, if there is a 30-year-old woman and that too she has been diagnosed with PID, the indication for surgery is an intestinal obstruction. So there is a criteria for surgery for PID. And see, peritonitis, sepsis, and tubo-ovarian abscess, we don't do generally surgery. And what is indication for surgery? They should be managed medically first, and then we have to do surgery for that. So yeah. So the criteria for surgery, I will just repeat the criteria for surgery. So see, it's an 30-year-old woman who is diagnosed with PID, and yeah, it's a 2 mass. No, it's not a mass, it's an intestinal obstruction, which is the indication for surgery here. So yeah, the question was indication for surgery in 30-year-old woman with PID. I will just tell the criteria once. It's like if you have a pelvic abscess by colpotomy, you can also, these are surgeries. So leave that. So yeah, next question we will move on. So you do a 2D echo for a patient who was presented with severe exertional dyspnea, chest pain, and occasional fainting spells. So it reveals a mitral valve area of 1 square meter, elevated LA pressure, and significant RV hypertrophy with TR. TR, it's a tricuspid regurgitation. Which is the next best step in evaluation of this patient? And the options are cardiac MRI, CT pulmonary angiography, it's a right heart catheterization, or it's a ventilation by perfusion scan. So yeah, I will just repeat the question once. So you do a 2D echo for a patient, and he comes to you with a severe exertional dyspnea, chest pain, occasional fainting spells. So just think about diagnosis here. Just remember what I think of the diagnosis. And it reveals there is a mitral valve area of 1 square centimeter, elevated LA pressure, significant RV hypertrophy with a TR. So which is the next best step in evaluation of this patient? Options are cardiac MRI, CT pulmonary angiography, right heart catheterization, or it's a ventilation by perfusion scan. So yeah, if you can just tell a diagnosis, I will be, or I will not, everyone will be happy here. So yeah, if you can just tell a diagnosis here. So yeah, the mitral valve area they have given 1 square meter in this condition. Mitral valve area they have given 1 square centimeter, which suggests a mitral stenosis, and this leads to the elevated LDL they have already given, subsequently pulmonary hypertension. So yeah, basically the answer is C, that you perform a right heart catheterization for this condition. It's basically gold standard. Yeah, join sir for what? I can join you, but what will you do by joining? So yeah, I would say that okay, the answer is basically C, that is a right heart catheter is the right answer. Why? Because that is the investigation choice for pulmonary hypertension. Because we have a mitral valve area of 1 square centimeter, which is very small. So we will think of mitral stenosis. So if we have mitral stenosis, we have to think that there will be high pulmonary hypertension in this condition. So yeah. So right heart catheterization is a gold standard for diagnosing a case with pulmonary hypertension. So to remember that. Next we move on. It's a line probe assay done on sputum sample of a patient with TB revealed overexpression of INHA gene. This can lead to cross resistance of isoniazid with which of the following drugs? It's rifampicin, ethionamide, cyclosporine, or ethambutol. So yeah, if you know the answer, it's well and good. I will just tell you, it's a line probe assay done on a sputum sample of a patient with TB revealed overexpression of INHA gene. So this can lead to cross resistance of isoniazid with which of the following drug? Rifampicin, ethionamide, cyclosporine, or it's an ethambutol. Anyone wants to answer? You have to remember that there is no choice. Generally, I think they cannot give you this, but yeah. So yeah, that is the overexpression of INHA gene, so which will lead to a cross resistance. That is overexpression for the gene of INHA will lead to cross resistance of isoniazid with ethionamide. You have to remember this. There will be cross resistance with ethionamide and isoniazid. So there is nothing to tell about this. Okay, next we have which of the following is an adrenolytic agent that can be used in the management of patients with adrenocortical carcinoma. Options are mitotane, that is a metyrapone, it's a ketoconazole, or it's a telostane. I'll just repeat, it's which of the following is an adrenolytic agent that can be used in the management of a patient with adrenocortical carcinoma. Options are mitotane, metyrapone, it's ketoconazole, or it's a telostane. So yeah, if you can answer this adrenolytic agent. Anyone wants to answer this? Okay, the answer here is A, that is a mitotane, which is adrenolytic agent as given in the question. It's an adrenolytic agent which can be used in the management of a patient with adrenocortical carcinoma. So yeah, it's an insecticide derivative. It is effective in the treatment of benign cuttings also, and rarely used due to its side effects. So yeah, it's also you have to remember it's a mitotane for an adrenocortical carcinoma. So yeah, let's move on. Yeah, it's an image based question here. Okay, the child is there with a complaints of abdominal pain and vomiting for the past 24 hours associated with tenderness over the McBurney's point. Undergoes open appendicectomy. So however, during surgery the appendix was found to be normal. On exploration of the ileum, the following finding is seen. Which of the following statement is false regarding the condition? So yeah, just tell what is there in the image. The image is basically it's a Meckel's diverticulitis. Okay, it's a case of Meckel's diverticulitis, and what they have given is a case scenario of acute appendicitis, but it's a case of Meckel's diverticulitis. So on exploration of ileum, the following finding is seen. So which of the following statement is false regarding this condition? So yeah, it's lead to a point of intussusception. Gastric mucosa is the most common heterotopic tissue. It arises from the mesenteric body, or it's located 60 cm proximal to the ileocecal valve. So yeah, basically the question is it's a case of a diverticulitis, that to Meckel's diverticulitis. So the options which I told basically the question is which of the following is false regarding the Measles diverticulitis. So yeah, it's false. So I'll just repeat the options if you wish. It is a lead point for intussusception. Yeah, it's the right answer. And gastric mucosa is the most common heterotopic. It's also right. Arises from the mesenteric border. No. Always remember that if it's a case of Measles diverticulum or diverticulitis, it never arises from the mesenteric border. It's the anti-mesenteric border that arises the Measles diverticulitis. And the last one was located 60 cm proximal to the ileocecal valve. Yeah, that's the right point basically I'm asking. But yeah, the right answer is it arises at the mesenteric border. No, it arises at the anti-mesenteric border. So it's located at the 45 to 60 cm proximal to the ileocecal valve. Next we have a mother noticed yellowish discoloration of a term newborn within the first 6 hours. On examination, jaundice extended up to the lower abdomen and thighs. So which of the following drugs can be administered along with phototherapy? So basically it's a case of pediatric question. I will just repeat the question. It's a mother who noticed yellow discoloration of her term newborn within the first 6 hours of life. So on examination, jaundice extended up to the lower abdomen and thighs. Which of the following drugs can be administered along with phototherapy? Options are SN mesoporphyrin, it's a tolazolin, it's a thromethamine, or it's a sucrose. Anyone wants to answer? Which of the following drugs can be administered along with phototherapy? So yeah, yellow discoloration within first 6 hours, jaundice up to the lower abdomen and thighs. So yeah. So see, if it's they have given within the first 6 hours. So if it's after 24 hours, it will be physiological. But within first 6 hours, if jaundice is there, you have to think of that is it's a pathological jaundice. So in case of pathological jaundice, it's what you can give is you can give SN mesoporphyrin. You can give SN mesoporphyrin with phototherapy in case of a pathological jaundice. So you have to remember it that way. So yeah, it's an SN mesoporphyrin given with phototherapy in case of a pathological jaundice. And you know what a pathological jaundice is, it's within 24 hours. So yeah, next we move on. It's a 45-year-old man who comes to you with a painless generalized lymphadenopathy and weakness. Lymph node biopsy shows the following picture. Which of the following is not true for this condition? So I'll just tell you what is the image here. Yeah, it's difficult, I think. Yeah, they have given it's a back-to-back follicles of variable areas and very less interfollicular area. I'll just say diagnosis. Diagnosis is basically it's a case of a follicular lymphoma, and there will be a back-to-back follicles of variable areas and very less interfollicular area. So yeah, it's a case of follicular lymphoma, and I'll just tell you again. A 45-year-old man who presents with painless generalized lymphadenopathy and weakness. Lymph node biopsy was done, and we have diagnosed it as a follicular lymphoma. So which of the following is not true for this condition? It's a BCL2 positivity, BCL6 positivity, aggressive course, or it's a possible transformation into a diffuse large B-cell lymphoma. So yeah, if you can tell the answer, it's a case of follicular lymphoma, and which of the following is wrong? BCL6 positivity, BCL2 positivity, aggressive course, or it's a possible transformation to diffuse large B-cell lymphoma. So yeah. Okay, I will just tell the answer here. It's I just told C is the right answer in this case. See, this follicular lymphoma is not aggressive. It's not an aggressive tumor. So basically, yeah, it's an indolent vaccine and vanning course. It's not an aggressive course. And BCL2 positivity is right. BCL6 positivity is also there. And there is a possible transformation into diffuse large B-cell lymphoma. So yeah, so it's not an aggressive, it's a waning. So which organization does the image, next question, which organization does the image given below stand for? So they have given a cross and there is one eye symbol in between. I cannot show you, but yeah, remember this. There is one, how will I show you? There is one red cross and in between the eye is there. So it's for, I will just tell the answer here. It's for National Program for Control of Blindness and Visual Impairment. So yeah, so it's National Program for Control of Blindness and Visual Impairment, and the symbol is red cross with an eye, that is rounded eye in between. Next we move on. Yeah, it's an easy one. Next we have is what is the most common hepatotoxin causing acute liver failure? Options are methotrexate, alpha-toxin, alcohol, acetaminophen. So it's an easy question. I will just repeat. What is the most common hepatotoxin causing acute liver failure? It's a methotrexate, aflatoxin, alcohol, or it's a acetaminophen. So yeah, anyone wants to answer this? Acute liver failure in caused by which of the drugs? Methotrexate, aflatoxin, alcohol, acetaminophen. Okay, I'll just tell the answer here. See, they are asking for acute liver failure. So in case of acute liver failure, the main drug which will cause this, it is acetaminophen. Okay, and yeah, that only acetaminophen is the most common hepatotoxin causing acute liver failure. And whenever they are asking it's a chronic liver failure, the most common drug is alcohol. So you have to remember that. Okay? The most common hepatotoxin causing, the most common hepatotoxin causing chronic liver failure is alcohol. So yeah, it's Dr. Saab, it's okay. I'm there. So yeah, next we have which of the following vaccines is used in the treatment of prostate cancer? Options are Talimogen Leherparvec, it's a Bacillus calmette-guerin, it's a Cipulsul T, or it's an Argan Pantucell L. So I'll just repeat, which of the following vaccines is used in the treatment of prostate cancer? So I know you might not be knowing this because prostate cancer treatment we know. Vaccines I also don't know basically. So I'll just tell which of the following vaccines is used in the treatment of prostate cancer. Options are Talimogenic Leherparvec, it's Bacillus calmette-guerin, it's a Cipulsul T, or it's an Argan Pantucell L. So if you don't know, it's not a big issue because BCG. No, it's not BCG. It's C, that is a Cipulsul T, which is an autologous prostate acid phosphatase loaded with dendritic cell vaccine. So yeah, the answer is Cipulsul T, and it is approved for patients with hormone resistant metastatic prostate cancer with minimal or no cancer related symptoms. So yeah, option B is used for bladder carcinoma. So you have to remember that option B, that is BCG you were telling. BCG can be given, but in case of bladder carcinoma. In case of a prostate cancer, you have to give Cipulsul T. And other options also we have, it's an Argan Pantucell L. So in case of Argan Pantucell L, it's an immunotherapy in case of pancreatic adenocarcinoma. So yeah, what I was telling, it's Cipulsul C, that is a Cipulsul T. So it is used in case of a prostate cancer, and BCG can be given in case of a bladder cancer carcinoma. So yeah, moving on to the next question. It's during a measles epidemic. It's a PSM question. During a measles epidemic in a community, an 8.5-month-old child was vaccinated for measles. So what is the correct immunization schedule to be followed for her regarding the measles? So the options are, it's an easy question if you know. The options are, the child should be given a second dose after 4 weeks. Second option, child should be given a second dose as soon as she reaches 9 months of age. Or it's the child should directly be given the second dose of measles at 16 months. Or the child should be given the second dose of measles at 12 months. Basically you have to know what is the immunization schedule. If you know the immunization schedule, you can just tell like that. So I'll just repeat once again. It's a measles epidemic in the community. An 8.5-month-old child was vaccinated for measles. What is the correct immunization schedule to be followed? So just tell me what is the immunization schedule for measles. No need to tell all this. If you can know this. For an infant immunized between, okay, just tell me if you can. I will tell you then. Okay, the answer is A, that is the child should be given second dose after 4 weeks. Because see, already it's an 8.5-month-old. So normally what happens, you give a first dose is 6 to 9 months, and then you give at the age of 9 months. Second dose should be as in the child reaches the age of 9 months. It is to ensure adequate immunity has developed provided that 4 weeks have elapsed from the last dose. Okay, so they are just telling you that there should be a difference between 4 weeks in case of a measles vaccine to be given. So first and second dose, there should be a difference of 4 weeks. And yeah, first dose you can give at 6 months, and then after that, after 4 weeks you can give that. So yeah, while the scheduled age of receiving measles is 9 months, it can be lowered up to 6 months during measles epidemic, because we are talking about epidemic in this condition, so it can be given at 6 months also. So yeah, 6 to 9 months, and then after 4 weeks you can give again the second dose. Next we move on. It's an X-ray. Okay, it's a 9-year-old girl was run over by a car and was admitted to the hospital with obvious swelling and deformity of the left thigh. So X-ray was shown, X-ray they have given, and what will be the preferred treatment in the given condition. So I'll just tell you the X-ray, otherwise you won't be able to tell. It's a fracture basically, it's a shaft fracture. It's a fracture shaft of femur. Yeah. So what will you do? I'll just repeat. It's a 9-year-old girl comes to you with the RTA, after a RTA, and was admitted to the hospital with an obvious swelling and deformity of the left thigh. So our X-ray showed the following findings, which is the shaft of femur fracture. So what will be the preferred treatment in the condition? So just tell me what is the preferred condition in the shaft of femur fracture. The options are gallows traction, lock intramedullary nailing, or it's a elastic intramedullary nailing, or it's just spica casting. Anyone wants to answer? Gallows traction, lock intramedullary nailing, elastic intramedullary nailing, or it's a spica casting. So yeah. And that you have to remember, it's a 9-year-old girl. So that age is very important in this condition. Anyone wants to answer? See, normally for pediatric also we give nailing we do, but yeah, okay, if you don't want to answer, I will just tell. See, the answer here is, it's a 9-year-old, it's a 9-year-old. So yeah, the answer is elastic intramedullary nailing. Why? There is a criteria for everything. Like suppose you have a 0 to 6 months, you will do a spica. That is a spica is for 6 months to 5 years. So yeah, if you have a 0 to 6 months of age and the patient comes to you with a shaft of femur fracture, you will do a Pavlik harness, and then it's from 6 months to 5 years you will do a spica casting, 5 to 10, that is a flexible. For children basically you do a flexible because the bone will grow, so you cannot do a rigid one. So yeah, that's why we do nailing also in this case. And greater than 10 years you put a lock intramedullary nail like adults will do. But yeah, if it's 5 to 10 years of age, you would give a flexible nails, and they cannot tolerate prolonged immobilization and all that. So yeah, the answer is elastic intramedullary nailing in this case. Let's we move on. It's a 56-year-old man who comes to the emergency department with severe chest pain and is diagnosed with acute MI. So which of the following can be used to assess the area of infarction in this patient? It's also easy one. Options are thallium-20, gallium, TC99M pyrophosphate, or it's a cobalt-91. I repeat the question. It's a 56-year-old man comes to you with a chest pain and you diagnose him as an acute MI. So which of the following can be used to assess the area of infarction in this patient? It's a thallium-20, gallium, TC99M pyrophosphate, or it's a cobalt-91. So yeah, it's an easy one, but if you know, it's good only. In acute MI, how do you detect the infarct? That is by which of the following: thallium-20, gallium, TC99 pyrophosphate, or it's a cobalt-91. Okay, I'll just tell. It's C, that is TC99. TC99 pyrophosphate is used for the detection of an infarct in case of a acute MI, or in case of MI only which we are talking. Yeah, it accumulates in the damaged myocardium and the area of infarct appears as a hot spot. So yeah, we are using TC99M pyrophosphate. Next we move on. Which of the following statements is true about prasugrel? That is prasugrel. That is PRASUGREL. Options are: it acts as an P2Y12 agonist. It is a 10 times less potent than clopidogrel. It's a prodrug, or it's a omeprazole interferes in its activation to an active metabolite. So I will just repeat which of the following statement is true regarding the prasugrel. Prasugrel is a drug, if you know. So it acts as a P2Y12 agonist. It is 10 times less potent than clopidogrel. It's a prodrug, or it's a omeprazole interferes in its activation to an active metabolite. So you can just answer. It's a which is true. Which of the following is true? If you don't just answer. Okay, the answer is very simple. The answer is C, that is a prodrug. So yeah, see, prasugrel is a prodrug which gets converted to a it gets converted into active metabolite, that is CYP3A4 and CYP B26. So yeah, since omeprazole is an inhibitor of CYP2C19, it does not interfere with its activation. It is 10 times more potent. clopidogrel, because it was written is less than potent, but yeah, it's not less potent, it's more potent, 10 times than clopidogrel. So you have to remember it's a prodrug. Prasugrel is a prodrug, and that's the right answer. Next we have, in which of the following condition would you expect to observe the Lighthouse Effect? So yeah, if you know what is Lighthouse Effect, you can just easily tell. It's an autosclerotic lesion, acute mastocytosis, it's an intratympanic glomus tumor, or it's a CSOM. So I'll just repeat, in which of the following condition would you expect to observe a Lighthouse Effect? The Lighthouse Effect you see in which condition? It's an autosclerotic lesion, acute mastocytosis, intratympanic glomus tumor, or it's a CSOM. So yeah, you can just tell the answer. Lighthouse Effect is seen in which condition? Okay, the answer is very simple. It's B, that is acute mastocytosis. You can see a Lighthouse Effect. Basically, acute mastocytosis is a complication of what? It's a complication of otitis media. That is ASM. It's a complication, and yeah, it's a pulsatile mucopurulent or a purulent discharge coming through the central pinhole perforation of pars sensa. This suggests a reservoir of infection in the mastoid and the middle ear. So what you see a Lighthouse Effect. So yeah, otoscopic sign and all I have given. So yeah, it's a Lighthouse Effect which is seen in case of acute mastocytosis. Next we have, given below is a skin lesion. So which of the following is not a criteria to assess its malignant potential? So I'll just tell what is the skin lesion here. It's a nevus. Yeah, it's a nevus. And that too, I will just tell the diameter, you will tell the answer. So okay, the diameter is greater than 6 mm. It's a diagnostic. Basically, it's a melanoma. You can just tell it's a melanoma. So what is the question? Which of the following is not a criteria to assess its malignant potential? So it's an irregular border, inhomogeneous color, diameter greater than 4 mm, or it's an asymmetry. So yeah, if you can just tell. I just told the answer only. Okay, I will just repeat. It's a case of a melanoma. So which of the following is not a criteria to assess its malignant potential? Options are irregular border, inhomogeneous color, a diameter greater than 4 mm, or it's a asymmetry. So yeah, if you can answer this, not a criteria. Okay, I will just tell the answer. It's C. Already I told the answer. So yeah, its answer is C, that is diameter greater than 4 mm. No. In case of a melanoma, diameter greater than 6 mm is considered for a metastasis. And yeah, others like irregular border, inhomogeneous color. Yeah, 2 is not the answer. The answer is C, that is diameter of greater than 4 mm is the right answer. Because see, normally if you do, it's a diameter greater than, that is 6 mm is diagnostic for a metastasis in case of melanoma. And others like irregular border, inhomogeneous color, and asymmetry are also seen for a malignant potential in case of a melanoma. So next we move on. Which of the following is the most common substance abused in India? So yeah, I think you can just tell this answer. Alcohol, cannabis, inhalants, or caffeine. So what is the most common substance abused in India? Alcohol, cannabis, inhalants, or caffeine. So this you can just tell. I want the answer, please. If you cannot tell this, it's okay, it's not that bad. But yeah, I will just repeat the question. Which of the following is the most common substance abused in India? Alcohol, cannabis, inhalant, or is caffeine? No, it's not cannabis. I know cannabis, you are thinking that in colleges, but no, it's not a college. It's a word, so you have to think like that. So which is the most common substance abused in India? Caffeine, no. Caffeine is not that much abused, because I also don't drink that much, but yeah. So your answer is that one. Is the right answer is that is alcohol only. No, not cannabis. So yeah, the right answer is alcohol. Alcohol is the most commonly abused substance in India, and as per all that they have given Nimhans and all that. Tobacco remains the most common abused in India. Alcohol is the second most commonly abused substance in India after tobacco. But yeah, they haven't given tobacco, so yeah, it's the alcohol. And see, cannabis, there is a point here. Cannabis is the most commonly used illegal drug in the world. So yeah, in that you can just remember, it's the most commonly used illegal drug. But alcohol, in every area you will find. Okay, next we move on. It's as a first year anesthesia resident posted in the emergency OT, you are handed the list of cases posted for surgery. So in which of the following patient can you plan to perform a spinal anesthesia? So basically it's a question is in which of the condition you will perform a spinal anesthesia. Options are a patient with polytrauma and massive bleeding, patient with pyogenic vertebral osteomyelitis, patient having a coronary stent attached to opetogrill, and or it's a patient with hypertension on amlodipine. So if you can just tell in which of the following patient you can use or you can perform a spinal anesthesia. Patient with polytrauma and massive bleeding, patient having pyogenic vertebral osteomyelitis, patient having coronary stent that too on clopidogrel, and patient having hypertension on amlodipine. So it's a deeper knowledge of anesthesia basically, but if you can know, it's a good one only. Not that deep, but So anyone wants to answer this? In which of the patient you can perform spinal anesthesia? Basically you have to tell the contraindication of spinal anesthesia and only you can just tell that. So your answer is D. So that the D is basically the patient with hypertension on amlodipine. So if you give an you have to remember that way. If you give antihypertension to the patient, it's not a contraindication for spinal anesthesia. You can still give, because in other cases like diabetes and all that, you have to stop the drug. Diabetes you cannot stop, but you can give insulin in that case. But so in case of antihypertensive, it's not a contraindication to give a spinal anesthesia. So what are the contraindications? I will just tell you the contraindications. It's an infection at the site of injection, patient refusal, increased intracranial pressure is also contraindication for spinal anesthesia. Then allergic coagulopathy, severe hypovolumus, severe aortic stenosis, severe mitral stenosis, and sepsis they have given in the question only. So you have to remember it's like a patient on antihypertensive, it's not a contraindication for spinal anesthesia. So last two questions. Identify the incorrect match, but I cannot say this because we have given the image. So what is right and what is wrong? How will I tell? So just tell it's an image. I just tell what they have given. It's an image of a pseudostratified ciliated columnar epithelium, and it shows irregular cells which are attached to the basement membrane, and it appears to be multi-layered. However, there is actually only one layer of cells. The multi-layer appearance is due to the fact that nuclear or epithelial cells lie at different levels. So it's okay. It's a pathology. So they have given 4 options and just like that what it is. So the last question for today. The last question is which of the following statement is false regarding the rabies vaccination? So this you can tell. I think I'll just repeat which of the following statement is false regarding the rabies vaccination. Options are: beaten dogs should be observed for minimum of 10 days. It's I think okay. Let's we have 4-dose regimen is given as 0.1 ml IM on days 0, 3, 7, 28. Then we have pre-exposure prophylaxis regimen consists of 3 doses, and the last option is the dose of human anti-rabies immunoglobulin is 20 international unit per kg. So I will just repeat the question. Which of the following is false regarding the rabies vaccination? So first, beaten dog should be observed for minimum of 10 days. Second, 4 doses regimen is given, that to 0.1 ml IM at 0, 3, 7, 28, and pre-exposure prophylaxis regimen consists of 3 doses. The last option is the dose of human anti-rabies immunoglobulin is 20 international unit per kg. So if you can tell, it's an easy one if you know the rabies schedule. Okay, I will tell the answer here. The answer is basically B is the right answer. See, for the rabies patient we give 4-dose regimen. We give at 0, 3, 7 and 28, that is right. But they have given intramuscular. We don't give intramuscular. We give intradermal. So you have to remember that. Rabies vaccination we give 0.1 ml intradermal, and that too on 0, 3, 7, 28. And other options are right. Beaten dogs should be observed for minimum 10 days. But I don't know where we observe a dog for 10 days. But they have given. Is the right. So beaten dogs should be observed for 10 days. Pre-exposure prophylaxis, and also 3 doses are there. And dose of human anti-rabies immunoglobulin is 20 international unit per kg. So we complete the MCQs here for today. Thank you so much for joining, and good night. Take care.